plant seeds and put birdies in these legislators' ears that I'm coming to see them because I want some help legislatively with the foster care system
For
because some
sure.
of this stuff is insane. And
Yeah.
it's not all, when I say that the foster care system is broken, it's not just the provider agency, it's
Yeah.
the system itself. And you mentioned stuff, and I've mentioned stuff where all these barriers and roadblocks are in the way. And I'm old school. I believe there's a better way.
Millions of families and professionals will touch the child welfare system this year alone. And it's the same every year. And this is the truth. Our system is complicated, it's confusing, and it's difficult to navigate. I'm your host, Shanelle Dupree, and this is Navigating Child Welfare. Because I don't know anyone who has navigated a system confused and has achieved the best possible outcome. And the outcomes are not just simple metrics. We're talking about families, we're talking about communities, and we're talking about impacting generations. So hug your loved ones a little bit tighter and let's dive in to make connections, gain clarity, and navigate the child welfare system well.
Yeah, look, I wanted to reach out because you're doing great work. And look, I'm involved in so many different areas of children's advocacy. We're a long time, my wife and I are a long time. We did family care for the state, which was disabilities,
New
autism,
York or New Jersey? Where are you?
New York, New
Okay.
York,
Mm-hmm.
and it was. We had blind kids here. We had Alzheimer's. My wife and I decided we wanted to go younger. This was years ago. So
Mm.
we got a kind of a background in it. I also have a 35-year-old son who's autistic. They didn't diagnose him where nobody knew what it was back then.
Yeah.
So I had a lot of experience going through and learning the hard way, to be honest with you, that part of it. Anyways, we wanted to get out of the family care part of it with New York State, and we got into foster care. But that several decades ago, we've been doing it
How
in
is family care versus foster care different? What is that? What does that mean,
family
family
care is
care?
through this. Family care is through the state.
Mm-hmm.
It's through a program like if somebody's in a facility and they're doing pretty well, say somebody's a blind 18-year-old kid is blind and he can get a lower level of care. So they try to put him into with a family. And it's that kind of a program. And we also took Alzheimer. Um, we had a 70-something-year-old here. We've had others. Um,
Wow.
a lot of disabled, but you know what? A lot of it is. I look back at it now at a whole different perspective. Is I think a lot of times they were just trying to push these individuals out of the facilities because they needed somebody
Mm.
maybe with a higher level of care, and that doesn't mean that the ones we had didn't need care because the first kid we got who was blind was punching holes in walls
Mm.
at the facility he was in, and he came here and he did it once, and our reaction was a little different than everybody else's. There, they would, I don't want to tell you this because it tells you a little bit about what I try to do, which is teach. He would punch holes there, and he'd go sit in his room. He had this reclining thing, and he'd play games or watch TV after he
Mm.
punched a hole in the wall after behavior. And I asked him, he did it the one time here, and I asked him, um, why he did it. He wouldn't really give me an answer at that particular time. I said, I want to know if you would help me fix it. And he surprised me, he said, yes. We stretched it out intentionally.
Mm-hmm.
We had him sanding, and he would come home after program and literally sand it and was so enthralled with how he fixed it that he did this. We actually had him do almost all the steps and he fixed it and he never once punched a hole in our walls in our house, and he was here 6 years.
Wow.
Not once.
Wow.
Um, it was a teaching moment. I know, I remember telling the state, and a lot of times with the bureaucracy part of the state, they look at these things as corporal punishment or whatever, or they look at things differently. We
Mm-hmm.
didn't. We looked at it as a teaching moment. He volunteered. He wanted to do it, and he never did it again. And we're
Mm-hmm.
talking about a kid who's punching holes. I went in his room at the facility he was in. There had to have been 20 holes that they hadn't
Oof.
even fixed because and you could see where they had patched others. And so he never did it again. The kid's still, he's now in an apartment with a couple other guys, and he calls me almost daily. He comes here for Christmas, all that kind of stuff. But
That's beautiful.
so it tells me, look, I know we did the right thing.
Hmm.
Anyways, we wanted to go to the children. My wife wanted to go younger. We went younger, got into therapeutic foster care. And I'm going to give you a number that's probably going to shock you. 178 kids have come to our home in
Hmm.
foster care.
Hmm.
Have either through respite, therapeutic foster care, which is mostly what we did, which is the high end, high needs,
It is.
extreme behaviors, profound
Yes.
autism. We didn't get like CPS calls right out of in the middle of the night type placements. We had a couple in the very beginning. For the last decade or plus, we got the foster kids that were kicked out of everywhere else. Some of
Gotcha.
them, 20 foster homes,
Yep.
and we would intentionally be okay with taking them because we knew that we could help and that somebody had their back. And when they did something here that they would test us, they would test and they would, and because they knew that, well, the previous 20 homes kicked me out. I know we're going to be 21. Steve's house is going to be 21. And then when we didn't do it, these kids completely changed their whole perspective on everything. And most of those kids come back. We know where most of them are. And they come back for the holidays. They come back. We've got them in military. We've got them adopted. We've got them back to bio families who we still in contact with. We've got them into college, and we know that for the most part, I look at it at how many we that got away that we couldn't really help, and that's the part that breaks my heart, and
Hmm.
that's the part that's broken in the system. Is one to we're almost at the end of our third adoption. I'm an older guy, but I
Right.
can't let these kids go because if we do, they're going into facilities. All three of them would have gone. And we went to bat for him in court. I got myself in trouble with the provider agency and the county and everybody else sticking up for this kid. But you know what
Hmm.
happens? That kid knows that I had his back.
Yeah.
And he's never forgot it. And when it came time to push came to shove, we didn't know, um, none of the relatives were deemed appropriate. There wasn't anywhere else to go. He could have been photo listed or getting ready to list him. He didn't want to be. He wanted to stay.
And we know that photo list is when they publish kids' pictures and put them
Right,
kind of up for adoption. Okay.
right.
And so,
And
but you were a long-term placement.
we were a long-term placement. And they did try to, because we wouldn't commit to the adoption part of it. And the reason is because what happens in this particular provider agency is they don't put supports around you. And if we don't have
Yeah.
supports around you, I got to make sure this kid isn't stranded somewhere if I'm not
Yeah.
here anymore. And we wanted to make sure he got OPWDD certified and have eligibility. And we just finished all that. And
Okay, hold on. So is that your state's kind of waiver process,
yes,
like disability, being able to access services?
yes, yes,
Okay.
you'll get a care core organization management firm that would it's called Life Plan in our area who
Okay.
take over
But
resources
Steve,
and
how long did that process take? Because I've heard of people being on the waiver list for years.
yes, yep, yep.
It took
Now,
years.
yeah, now the only reason this David's took a while. We don't need his eligibility. He's doing well. Michael, who we just we're adopting in the next 2 weeks. He think about it. He was first deemed OPWDD eligible in 2016.
Mm,
And because you have to update in New York State all this stuff, you have to have a psych eval every 3 years. You have to have all this information
okay.
and updates to get re-eligible for it. We asked them years ago, 2 or 3 years ago, to do it. They didn't do anything.
Yeah.
Nothing. We had to have our lawyer push it. And you're right. These kids will sit on waiting lists for years
Yep.
and sit and even wait on adoption stuff. And, we have the highest number of days in care for foster kids in the entire state,
Mm.
more than New York City, Buffalo, Rochester, Syracuse. That's crazy. It should not happen.
What
And
do
I
you
know,
think it is?
and
What
no,
is it?
it's basically it's people not doing their job.
Mm.
When the law says 15 to 22 months, everybody should be geared towards that, and they're not. They just
Well,
postpone, postpone, postpone. Uh,
Let let
and
me let me push back though, Steve,
go
because
ahead.
I have worked in many different systems, including, of course, so the court system and then as an administrator. And what you're naming is a common thing that we see across the nation. We say the system is broken, people aren't doing their jobs, no one is held accountable, children are languishing. But then there's like this other part where it's like we put too much on workers
Oh,
and
look,
they don't have supports. You know what I mean?
look,
And
can I
they're
rephrase it first?
for sure.
It's not the case planners, the case aides, the therapists that come to my home, all the ones that are involved with the kids that have been in our home over the years. It's administration, to be honest with you. It sits, some of this stuff is sit on their desk. The other thing is the agency that we're associated with has been around 150 years.
Okay.
The last 8 years, they changed management. The culture completely went to crap.
Mm,
Where I used to have one supervisor before I got to see the director of foster care. If I had an issue with one of our kids, I wanted to get some supports around him. There would be one supervisor I had to see, and that's it. And then I could go to the director if I didn't get an answer that would help the kid. There's probably 10 levels now.
see,
They've
you're
got two
naming,
or
yeah,
three.
bureaucracy. You don't
It's
know who to call.
right.
Everyone gives you a different answer every time you call.
That's what I'm saying. It's
Yes.
that kind of stuff that drives me insane. I don't even know what a lot of these people do. Some of the caseloads are crazy.
Yeah.
I don't know how these
Yeah.
people are eating the ground. And yet they add
Yeah.
more bureaucracy on this
Yeah.
this culture that's in there right now has added a ton of paperwork.
Well, that's the thing, Steve. They don't stay, they quit, they leave, and then
70%.
yes, and then you have the next person that's trying to catch up. And it's like you have to start all over. You have no trust, you have no confidence that what and so it's a for me, it's a framework problem where we don't have proper supports and partnership and people within the system don't think that they are. So our mental health providers, our faith community, all these different communities really need to be supporting and surrounding this family. It can't just be on the caseworker because they can't solve complex family issues, especially 100 of them, right? When we're thinking about their caseloads at times. And so you're speaking to very real issues that exist. And so then it's like, now what? Right? So what is that next thing that we do as people who have worked in the system, who see it, who are like, I know what the problem is. How then do we work to like make changes, even if it's just
Right.
like one thing? What is that next thing? So you said you're going to start talking about some of the issues.
Yes. Look,
Okay.
I have a podcast right now that's geared towards autism, child advocacy, mental health, disabilities, all of that. I've said very little. We've been doing podcasts for 2 years.
Okay.
I've said very little about the foster care system because I was so entrenched in it. And to be perfectly honest with you, they will retaliate.
Yeah.
They
Okay.
positively will retaliate if you talk about
Gotcha.
it. And now it's a little different. I'm going to be out.
Mm-hmm.
And more importantly, Chanel, is that I, having done what I do, and because I do advocacy not just locally and in my county, I'm on every state board there is, all the way up in the state levels. I've met with commissioners legislatively, and in a ton of one of the parent groups I'm in has 18,000 families in it.
Wow.
And a lot of them have foster kids. And so my reach is out there. And what
Yeah.
I'm finding is when they don't get any results, and some of these things happen, and the foster family is lost, and more importantly, the child is not getting supports, they're reaching out to me. And I have dozens of aged out foster kids that want to be heard. And Chanel,
Yeah.
they're not being heard. They don't
Yeah.
have a seat at the table. They never had a seat at the table.
Yeah.
And I want to bring them to the table. I want them to
Mm-hmm.
tell their stories and certainly be respectful and
Mm-hmm.
professional and all that. But I want to bring the stories out there. I want to, I've talked to our legislators from here to Albany. I went to Washington, D.C. in March. I'm trying to plant seeds and put birdies in these legislators' ears that I'm coming to see them because I want some help legislatively with the foster care system because
For
some
sure.
of this stuff is insane. And
Yep.
it's not all, when I say that the foster care system is broken, it's not just the provider agency, it's
Yep.
the system itself. And you mentioned stuff, and I've mentioned stuff where all these barriers and roadblocks are in the way. And I'm old school. I believe there's a better way. And if you
Sure.
check me out on LinkedIn or my Facebook page, you're going to see that I'm very actionable. I
Hmm.
fix stuff. If I see a problem, I'm not waiting for the state to be the cavalry.
Yeah.
I just go do it.
Yep.
And you'll see some of the stuff I've done in the area in my county, and it's gonna. I actually got a national film crew that came in, did a story. Some of the initiatives are going across the country now. It's two of them that I did here,
Do you want
and
to tell me about one?
one my son had nowhere to go. I built a autism barn for him. It's supposed to be a 10 by 12 shed for him to hang out. You can't just go to the mall and
Mm,
strum on a guitar or something and walk around. It's the same old story. When you have back then, he would have been categorized as profound autism, very few friends, lots of issues, couldn't go anywhere. He had nowhere to go. And so I built this, told my wife, I want to build this shed. And I just kept having to bribe her. And it wound up being a two-story um, thing. And then what happened is his friends from program would come over, and my son was thrilled to say,
yeah.
"Look, this is mine. Look what we can do, guys." And he bring his
Yeah.
friends over. A lot of them had autism. A lot of them had mental health issues. Some foster kids, in his own little network. And then what happened is some people in the community found out about it, and then they would come over with kids, and people would just call me up. Hey, can my son come over and hang out there? And we didn't even. It's still not locked. My wife says
Wow.
crazy. We've never ever had an issue ever.
Yeah.
Anyways, somebody tipped off Spectrum. It was open 3 years before anybody knew anything out there in the public, really, because I didn't do it for that reason.
Right.
Um, and so Spectrum News picked up the story, and the next thing I know, I've got 20 nonprofits in the area using the barn.
What?
Yes, yes, yep. And so it's become a huge hit. We don't charge. I have a snack bar in there, and they can get water and juices and stuff like that. And it's a cool place to hang out. And we have stuff that blows these kids' minds, like the old 8-track players, record players, all kinds of music, guitars, drums. And they come in, they're all afraid to touch it, or the might come with them, or they'll say, "Johnny, don't touch that." And I say, "No, if it's okay with you, Mom, I want Johnny to touch that.
Yeah. Yeah.
Go ahead, do what you want. We have extra guitars. They break the strings. I don't care." And when you give them that environment, you don't get the theft, you don't get the misuse,
Mm,
you don't get the other stuff. They're there to have fun,
yep.
and it allows them to have fun. We have an Xbox system in there on the wall. It's big. It's hardly ever used. It's
Wow.
all the other stuff that's used in there. All these cool things, sensory and the old games, the old knock hockey games, puzzles, all that old stuff.
I love
Um,
that.
yeah, and um, the what that triggered was the state realizing, how did you do this, Steve? Um, with just I just did it, and it started to get out there. Like I said, OPWD, the big state agencies are all interested in doing some kind of thing with it now, but I want to keep it private because I can get it done. And keep the state right out of it. The other thing I did was we were having a huge transportation problem with people with disabilities, people in foster care, people in that have autism, whether it's a doctor's appointment, whether it's a rec trip.
Mhm.
None of the agencies, and we have a bunch of them in our area, ARCs and stuff. Nobody runs vehicles at night and weekends, and that's where the activities are that these kids want to go to, teens,
Right.
adults. And so I was part of another nonprofit on their board. They closed up and they appointed me to dissolve it and all that. And I didn't want to dissolve it. I wanted to take the assets, which happened to be a building and a little bit of cash in it, and got tried to find a nonprofit agency that would tie in to do some of the programs that I wanted to do that I knew worked, that maybe were outside their scope. And everybody at that time turned me down.
Mm.
Everybody. The ARCs, and they're getting a free building, $500,000 building.
Tell me what
Um,
ARC stands for.
Association, they've changed it. It's Arc of Oneida Lewis now. In the old days, you don't want to, it's kind of a
Okay.
derogatory name.
Oh,
Um,
okay.
but it's Arc of Oneida Lewis.
Mm.
All of them turned me down at that time.
Okay.
And so I brought it to the veterans in the Veterans Outreach Center here. And the
Okay.
reason I brought it to the veterans is because they get stuff done.
Mm-hmm.
And in hindsight, it was a very smart move because they put me on their board, and I'm the only veteran, non-veteran on the whole board. I'm not. My father served, my grandfather. I have not.
Mm-hmm.
Um, and they put me on the board, and I wanted to bring some of these initiatives in there. One of them was called an ability bus, and I says I want you guys to buy this bus, and I came prepared. I had done my homework about what I needed to do to make it as simple as possible for them to make it happen. A 15 passenger, we don't have to have a CDL driver. I want
Mm-hmm.
these volunteer retired firemen,
Mm.
retired veterans to drive
Yeah.
the bus. And see if we can they would pick up the postage, pick up the gas on and I found the bus. I found a used bus for them in great shape. The veterans bought it the next day, the very next day. Now, Chanel, you know bureaucracy, I'm sure. If
Yes.
I tried to do this through the state, it would
Five
take
meetings, a
I
work
figured
group.
I figured it'd be 3 years in committee, only to tell me all the reasons why I can't
It
do it.
can't happen.
We can't do it. And it's been up for 2 years. And what happened was my state says, you know what? Steve's doing decent work down there in Utica, and um, we had this pilot program through Georgetown University, and we want they called me up and they want to know, hey, would they can we send a film crew to your house to film what you're doing in Utica? You have lived experience. And I, we're a diversified family because we don't care the color of anybody's skin. We've
Hmm.
adopted, most of the kids here have been um, not white, like, my family. Um,
Hmm.
but so we're very diversified because we never cared about any of that's crazy. And they came here and they spent 3 days here filming. I had my house torn apart. It was tough sell to my wife, because there were cameras, you know, not certainly not in the bedroom part of it, but the
Right.
kitchen, living room, the barn, everywhere. We had the bus brought here to take some of the kids in my thing here and a couple others in the community, one in a wheelchair because it has a wheelchair access on it, to one of the farmers markets here and that day, and they filmed all of it for this OPWDD New York State initiative with Georgetown. And this national film company that who came in to my house who said they were fantastic. He's got his own success story. He's out of Washington, D.C. They're very successful and well connected. He had to go to one other house because they picked two houses in the state to do this filming thing, and we were one, and the other one was in Rochester. He goes to Rochester the very next day after he leaves us, and all they were talking about out there was everybody was complaining about transportation. And he said, all I could think about was that bus initiative you did, Steve.
Yeah.
He called me that night and he says, I'm going to make some phone calls. And I don't know what he's talking about. You know what I mean? With any of that stuff.
Yeah.
And he um, emails me the next day with a 8-page proposal. He says, how would you like to open up a 501c3 with me based in Washington, D.C., called worthdoing.org? And I want to put two buses in every single state in 2026. You in? Of course I'm in. And not just that, but he put his money where his mouth was. He brought his whole film crew back here for 4 days. They're supposed to say two. We got him to stay an extra two because they were having a blast here. They were cooking out for my kids. I mean, that's
Wow.
how cool it was. This producer but the what was nice about it is that um he's going to make short things on it. He's going to make a documentary about it,
Yep.
of just this bus, and then he's going to make some shorts on it, and we're going to approach other states like Rotary Optimist, a veterans organization in another state,
Mm.
and see if they'll take it on with a similar project, realizing that we've taken all the bureaucracy out of it. We've taken all the issues out of it. We've made it simple, and we're not even rolled out yet. Because we're in a process. He got the 501c3 started. We're getting ready to put a website up. We haven't even started yet. And I would say 6 or 7 states are
Yeah.
already in. They're really, I'm talking groups. and also maybe a parent who could help spearhead it, maybe like myself, and they're stepping up, and so
Well,
we know that
Steve,
we go ahead.
yeah, I mean, I asked you earlier what is the thing that we can do? What is the thing that's being done? And you're naming what you're doing. Like you saw a problem and you like just started doing it. You filled in that gap. Someone came along who had resources, who had some of their other technical assistance, and they're like, we're taking this nationwide. And so that's amazing that that's happening and that you not only talk about problems, but you
That's my
work to
whole
solve those
goal.
problems. Yeah, yeah, I
Look, I
love
can sit
that.
here all day and talk to you about all the issues in foster care and child advocacy, the mental health, the juvenile justice part of it, because we take those kids too.
Yep.
Um, but I'm solution oriented, and it bothers the heck out of me when I approach the provider agency with solutions and they discount me. You're just a parent,
Yeah.
foster parent. The county commissioner, I've had several meetings with her, nothing happens.
Yeah.
So you know what? I'm going to go do it. I'm
Exactly.
just going to go do it. And my goal is because I'm going to be, partnering with this national film firm, is to spearhead some new documentaries. One of them on the foster care system, and his outreach is he's in 6 continents right now with his film company. So I know he's got tremendous outreach, and I want him to film some of this stuff, and not just we could come in here guns a blazing and blow up the system with look what
Mm.
happened here. These kids, because there's kids getting hurt in our county right now
Yeah.
because of situations that are going on. It, even in foster homes, and
Yeah.
they hide it. They don't put. And I could come in and blow all that up. I know those stories. I could do that. I don't want to. Doesn't mean I don't want to tell the stories, but
Yeah.
I'm going to come in with solutions, and I'm going to, and I've told them already, and the other people that we expect to have on the board, that I want an end result to this. I want a solution to this, and it's kind of why I reached out to you, and I'm interested in talking to people everywhere. Is because I think there's a lot of similarities. Doesn't matter what
Hmm.
state you're in.
Yep.
Um, and in the fact that um, I think that we can move the needle, and I don't know if we can move the needle bureaucratically anymore.
Hmm.
Um, I wanted to tell you one more thing. The barn thing that I did, which is on my own property, I am donating to one of the nonprofits here who's putting in an intentional community for autism. It's going to be like a centerpiece of they're buying land. They're going to put homes and stuff like that for autism with staff, and a pretty cool concept. And
Hmm.
I'm going to donate that to them. It's kind of that one would be geared kind of the autism stuff, and that wasn't enough. Um, I wanted something even bigger because my barn is full right now of stuff, and we can get maybe 30 people in it. But I wanted to do something on a bigger scale. So again, with the veterans, I got them to buy the church next door, this big spread. I mean, it was they're I think the people that were attending were down to 20 people, and they were looking
Yeah.
to sell,
Yeah.
and the vets went in with a really low offer and they got it. And the second floor of that is being converted into a rec center for profound disabilities, profound autism, wheelchair accessible. We even put they put showers in. And you know how
Wow.
expensive this stuff is? Do you know
Yes.
what the bottom line is? We have not used any state dollars. We
Mm.
held a local gala when we first decided to break ground and what we wanted to do. We raised 175,000 in one day. Way before your time, the movie Field of Dreams. Uh,
Build it and they will come.
you
Yeah.
know it. And that's kind of my philosophy. You know what? I'm just gonna build it.
I want to give a special shout out to Steve for allowing just a conversation that we scheduled to have to be turned into a podcast episode. I just had to share how a person who sees issues just begin connecting with others and seeing how he could make a difference. And Steve has made a difference in his community. That was part one. You're going to listen to part two next week. You're also going to have the show notes regarding Steve's different organizations and some of the different projects that he mentioned. They're going to be linked in the show notes. And you are invited to take the 360 degree assessment. This assessment is located on our website, www.sinkingchildwelfare.com. The link will be in the show notes. Once you take this assessment, it's going to tell you where you fit on the 360-degree map, how you work with other partners, how supported or overwhelmed you feel, and how ready your organization is to partner and build trust. The entire purpose of the Sinking Child Welfare Program is to help folks reclaim their time and peace of mind through simplifying the system and supporting people doing the work of reintegration and restoration. Let's connect today.